Welcome to Your Health, your television and online source for veteran medical and health information from the Phoenix VA healthcare system. I'm your host, Paul Coupeau, and today we'll meet one of Phoenix VA healthcare system's most esteemed doctors and research specialists. Later, we'll take a look at how you can stay fit at home with a simple, inexpensive exercise tool. But first, we have a special story about how horse riding and horse care is helping our veterans work through PTSD and other military-related medical issues. Let's check in with our field reporter, Christian Normandy, at the Equine Therapy Program at the Horse Rhythm Foundation.
Roz, why don't you tell us about the equine therapy program you run for the vets?
I work at the CLC as a recreation therapist, and we started this program in October of 2012. We received a grant, and we bring them out here to Horse Rhythm Foundation. They all have doctor's orders for specific reasons to be here, and we just involve them in the socialization and the riding and grooming of the horse.
So what kind of doctor's orders do the patients need to participate in this program?
It's their primary physician that is at the CLC. We meet as a team in the care plan process, and it's not just the doctor, it's the nurse practitioner, it may be the physical therapist who makes a recommendation for the program. And for several of our veterans, it's physical. It's for physical improvement and reduction of pain. My focus is always on reduction of pain, depression, and also improving their physical status. So the doctor gives an initial order for the program, and then we write and chart and make recommendations to expand on the equine therapy.
Can you describe a little bit about the actual therapy that the patients go through in this program?
Okay, it starts on the van ride out from the VA to the ranch. I do a pain scale on each patient before they ride on the horse, and I do it after they ride on the horse to kind of document is there any improvement in their pain. In addition, before anybody enters the program, I do a geriatric depression scale and see where they're at on the depression scale. Look to see if there's any improvement in that. Then they get here at the ranch. The minute they get here, we have veterans that are volunteers with the Horse Rhythm Foundation that all meet and greet them. They come on the bus. They help us unload. They just give them so much love and attention. So that's the social part, the connection, the engagement. And then they get to introduce themselves to the horses, maybe the horse they're riding. We also have other horses out here that they are just here to groom, to pet, to brush. And then the riders actually then get assistance from the volunteers at the Horse Rhythm Foundation to load onto the horse. We time their time to see if there's any improvement, and then they get fed. They get drinks, they get a lot more socialization after they ride.
Now you say each horse ride is timed. Is it a standard time for each patient, or is it depending on the patient's needs, and is there a goal that they try to reach on their times?
Yes, each person, we take the time from the minute they hit the saddle, and then it is gauged on where they're at. One of our first riders started at 7 seconds and now is riding 20 minutes. So it's individual to what their time, what they want, what they need, and they're always asking, what was their time? How can they improve?
So you track that for them,
yes.
And that helps in the recovery, I assume, as well, and the therapy of it all, as they get a goal that they can reach.
Definitely.
Can you tell us about some of the results that you've already seen since this program has started in October?
So many. I'll just pick a few. One is one of our veterans. He had to his service dog was no longer able to be with him, and he really withdrew from our activities, from even the nursing staff, didn't want to talk to anybody, didn't want to come out of his room. And I asked him, is there anything you've ever done or haven't done that you'd like to do? And he said, I always wanted to ride a horse, but I don't have any legs. I can't do it. So he was our first person that we selected, and he has come out of his shell. He's doing bingo, he does exercises, he does everything, and he looks forward to equine therapy. The minute the calendar comes out, he has it circled and he knows exactly when, and even his significant others come out to his family members to visit him and see him. So it's been real positive.
What do the vets talk about on the bus ride back to the hospital from the therapy sessions?
That's one of the best experiences that I've had as a recreation therapist, because sometimes coming out we try to get them as early as we can, so I'm really trying to pull it out of them. Hey, this is your time last week, whatever. On the bus ride back, it's chatter just like a field trip. They're just like kids. They are so happy. They can't wait to get back to the VA to tell the nurses how long they rode, how much better they feel, and we're all exhilarated. Where on some outings we come back and we're all, ready to drop. They're ready to go. They're ready to keep going, and that's probably the best experience.
Is there any competition among the vets about their times and extending their time and the time they spend on the horses?
Good question. They try not to let that out amongst each other, but I have had several veterans ask me, well, what was Mr. So-and-so's time? And there definitely is that healthy competitive spirit.
Next up, Christian Normandy meets with our recreational therapist Karen Clark, who will let us in on the history and practice of Tai Chi.
Karen, can you tell us a little about Tai Chi? I don't know much about it, so from a beginner standpoint, what is Tai Chi?
Well, actually, Tai Chi is an ancient form of martial arts, but through the years it's developed into moving meditation. And today we're actually going to be practicing Tai Chi Cha, and that is 19 movements with one pose. And this was developed in 1979 by Justin Stone. He had gone through all the different Tai Chis, and he found that this was easier for all of us to learn.
Tai Chi Cha.
That's correct, yes,
Okay.
Tai Chi Cha. So would you like to go through some of the movements?
Absolutely.
All right. The first basic thing is weight shifting.
Okay.
So you're going to be stepping out on the left side. Tai Chi is always started on the left side except for one movement. So we're going to start out on the left side. Heel touch first. Very good. So we're going to bend that front knee and shift to the back. So this is a movement. Very good. So let's try that on the right side. Stepping out, heel touch first. Shifting that weight from the front leg to the back. Very good.
Rocking the foot. I notice
Yes,
it comes off a little
you
bit.
actually bring that toe up,
Okay.
and then the heel up in the back.
Okay.
All right, so let's start out with the platter.
Okay, the platter.
The platter is, we're going to visualize a circular platter out in front of us. Tai Chi is all about circularity, that flow of chi, that flow of energy. So we're going to visualize a circular platter out in front of us. Our hands are going to be relaxed as we rim the edge of this platter, starting on the left side. Hands starting on the left, so stepping out. So move forward, circling around that platter, back. Very good.
With the rocking we just did.
Yes.
Okay.
And last one. As we come back, we bring our feet together. Taking this nice deep breath, we complete all our movements with a graceful conclusion. Deep breath in, exhaling out.
And
Very good.
slightly bend the knees when you
Yes.
exhale. Okay.
Hands out to the side. Now, to complete that flow of chi, we go to the right side. Hands starting on the right, heel touch first. Very good. Rim the edge of that platter. Third time, stepping back. Back to center. Deep breath. Now, variation of the platter is where you take a ball. We're going to step out, grab a ball from over our shoulder. So we grab that ball, our hands flatten. Very good. Coming back, grabbing a new ball.
Again, rocking.
Doing that weight shift. Coming back to center. Deep breath, exhaling down. Now to the right side, grabbing that ball of energy. Very good. Back to center. Very good. Next one we can do is bass drum. Bass drum, I want you to visualize a bass drum out in front of you. Your hands are going to rim the edge of that bass drum. Very good. And as you come around, try to keep those hands below your shoulders. Okay. So we'll start on the left side, stepping out. Hands start down. So you rim the edge of the bass drum. Very good. Very good. You're keeping your back straight. Excellent job. Stepping back. Deep breath. Now to our right side. Hands start down.
And I'm just really concentrating on keeping the rocking.
And you'll find that your coordination will improve after doing Tai Chi. Your stress levels will dissolve. Because with each deep breath, exhale stress.
And where can you find out more information about Tai Chi Cha?
You can actually, they have a lot of instructional videos on YouTube. Okay. Or you can get DVDs.
So who can perform Tai Chi Cha and who benefits the most from it?
All age levels can benefit from Tai Chi, the young even up to the seniors. You know, Tai Chi is very relaxing. It is non-stressful to the joints. It actually helps people with their coordination and their balance, so it's good for all age levels. Plus, you can do it sitting in a chair. You can get the same benefits from doing it in a chair. And after you've learned the Tai Chi movements, when you even visualize them in your head, you will get that same stress reduction. So it's good for all ages.
It's very cool. Thank you very much, Karen.
You're welcome. Thank you.
As a National Guard or Reserve member, you served your country. Now let VA serve you.
I wouldn't be here today as a successful woman without the help that I receive.
Your VA honors your service by providing a wide range of veterans benefits. From home loans to job training, VA benefits can help with some of life's toughest challenges.
What's important about VA benefits is they don't just touch you as an individual. They can touch your parents, maybe your grandparents, your child.
Go to benefits.va.gov/Guard Reserve to learn more, including how to apply online using e-benefits.
I just finished a master's degree recently, and now I'm working on another degree as well. So the military made that all possible. My veterans benefits made that all possible.
No matter what the time is, apply for your benefits. You earn them. VA is ready to help you.
Achieve your next mission. Learn about and apply for your VA benefits today.
Hello, I'm Sharon Hellman, Director of the Phoenix VA Healthcare System. Our veterans are bound by the uncommon experience and the singular valor of defending our nation's freedom. Our nation's servicemen and women exemplify the very best of our patriotic tradition. From the shot heard around the world in Lexington on April 19, 1775, to their extraordinary actions in Iraq, Afghanistan, and elsewhere today, our veterans, past and present, deserve our most sincere gratitude and abiding respect. Some of our veterans made the ultimate sacrifice, and to those heroes and their families, our debt can never be repaid. Others have suffered physical wounds but remain spiritually steadfast, inspiring us with their strength of character and enduring contributions. All of our veterans deserve nothing short of our highest praise and the most outstanding health care that we at the Phoenix VA healthcare system can provide. We are ever faithful to our promise to care for them and to afford the full array of quality lifetime programs to our injured service members. We thank you so much for your service to our country.
After the break, we'll introduce you to a fellow vet and learn about her experiences both overseas and back here at home.
From providing care,
I served in the United States Army Nurse Corps,
to serving near the front lines.
I was the first woman ever to deploy on a Strategic Air Command deployment.
Military women have served in many roles while paving the way for others.
I lobbied for women to be on board submarines.
The veterans' benefits you earned honor that service and can help with challenges you face on the home front. From job training to disability compensation to buying a home with a VA guaranteed home loan.
I'll be able to change my career and make more money and provide a better life for my family.
Find out more about your eligibility, including how to apply online using e-benefits.
I'm proud to be an Army Reserve veteran. My mission now is to help women with military service learn about their veterans' benefits.
Achieve your next mission. Learn about and apply for your VA benefits today.
I'm Terry Brookins. I've been in the Navy as a hospital corpsman for 25 years. As a corpsman, we basically take care of either the Marines or the Seabees. I was the chief hospital corpsman. I was the chief of the BAS, Battalion Aid Station, in Fallujah on Camp Knott, which was the Seabee camp. I volunteered to go out with the Marines. They would go out and do their knock and talks, and then they decided to start bringing in medical care for the people in the villages of Fallujah. The buildings were basically, they had big rooms inside because we would go inside the buildings of someone's home, and they'd have several big rooms and people would sleep on the floor. They'd have mats that they all slept on. The children, they were all excited because the Marines were there, and so they just wanted to come up just to see us and say that they were sick when they really weren't. All they saw was these invaders coming in and taking over their area. And for us to go in and give them any sort of help, I think made them trust us more, made them realize that we weren't really the bad guys, that maybe the bad guys were really the bad guys, like Saddam Hussein and his sons. It brought us closer to the people in the villages. They knew that we were there to help them, to try to give them whatever we could to make things better. Being outside the wire means that you're not on the safety net of a base. But going outside the wire for the first time and not actually being in a convoy and then getting out of the vehicle, it was a little scary the first time. My first patient was actually a little girl, probably 4 or 5. She let me take her picture, and a lot of the people don't let us do that. So I have a picture of her, and it's my greatest memory of being over there, because I know that I was there with a purpose, and that was to help these people. Not just to, take care of my Seabees, not just to take care of the Marines, but to go over and help these people with Fallujah. It was pretty amazing. The greatest benefit for me from the VA would be my education. I've already gotten my bachelor's degree. I'm working on my, it's a master's PhD program for industrial organizational psychology. I spent 10 years on active duty. That 10 years flew by. I said, okay, well, I'm not going to throw that away, so I'm going to do 10 years in the reserves. That 10 years flew by. At the end of that 10 years, about 19 years, I was mobilized for the first time. It's in my blood. I've been doing it my whole adult life, more than half of my life, and it's what I love to do.
Welcome back. Join me now in the kitchen with Chef Greg as he mixes up a new take on an old healthy favorite. We're here with Chef Greg Gonzalez from the Phoenix VA healthcare system, and we're going to be cooking oven brown rice today. Greg, thanks for being with us.
My pleasure. Well, I'm going to show you an easy way of making brown rice that's almost foolproof, and it's done in the oven. Okay, so how we're going to start is we got 1.5 cups of brown rice. We'll take them place in a pan that we can cook in the oven. To this, we're going to add hot water, 2 or 3 cups of hot water to the brown rice.
How much brown rice did we have?
We had 1.5 cups.
Okay.
And you want 3 cups of hot water.
Okay.
Okay, next, we'll season our brown rice with salt. Now, if your diet doesn't allow for salt, you don't have to use it. For a little bit of oils, I have here Smart Balance, which is heart-friendly. It has the better fats. We're going to put in about a tablespoon of that in there.
Okay. What can you tell us about brown rice? What's the benefits of that?
Brown rice is high in fiber. It digests slower, so you stay fuller longer. It has lots of fiber.
Okay.
And it's a better choice versus traditional white rice, in my opinion.
Okay.
Now, next what we do is we cover our dish or pan with some aluminum.
Okay.
And then we take and place our rice in the oven.
Okay.
You want your oven set at 360 degrees, and you'll cook this for about 55 minutes. So through TV magic, our rice is magically done. Like I said, it cooks about 55 minutes. Every oven's different, so check for your time and temperatures again.
Okay.
About 55 minutes at 360.
Okay.
All right. Let's take a look at our wonderful rice. And as you see, it looks nice and fluffy. It's perfectly cooked. And what's so great about brown rice is that it has a slight nutty flavor, and a little bit more chew than white rice.
Okay.
And there you go.
Good deal. Well, thanks for coming in and showing this to us today.
My pleasure. Thank you.
Thank you. For more information about this recipe and other healthy eating choices, come to the Phoenix VA website at www.phoenix.va.gov. Scroll to the bottom of the page and select Resources, then click on Newsroom and Healthy Living.
America's service members and veterans are strong, forged out of bravery, sacrifice, and duty. From all corners of the country, a family for life. But whether they served in lands far away or communities close to home, some of these men and women may face difficult times or even crisis. But sometimes reaching out for help can be the most challenging and worthwhile mission of all. Thankfully, friends, family, and communities are standing by their service members and veterans now more than ever. We're all in this together. When you recognize something isn't right, make the call to the Veterans Crisis Line or Military Crisis Line. During times of crisis, reach out and call. Dial 1-800-273-8255 and press 1.
Our very own Dr. Alan Thomas has been named Clinician of the Year by the American Thoracic Society. Dr. Thomas treats our vets with smoking ailments, lung infections, sleep disorders, and COPD. You work with a group of pulmonary staff physicians here at the VA in Phoenix. What kind of services do you provide to veterans?
Well, our group here at the hospital consists of 7 physicians and a physician's assistant. And we see the full gamut of pulmonary disease. In addition, our group's responsible for supervising the intensive care units, and a good portion of what we do is actually involved in the evaluation and management of patients with sleep disorders as well. I personally am involved primarily with pulmonary. We do evaluation. We have a number of procedures. We see patients with the full spectrum of pulmonary disease. Unfortunately, because of the use of tobacco in the military in the past, we see a large number of veterans with tobacco-related pulmonary problems, particularly COPD and lung cancer.
I understand that your services extend up to northern Arizona as well. How are you able to accomplish this?
Well, the northern Arizona veteran system is quite a bit smaller in terms of personnel than the Phoenix, and particularly with the internal medicine subspecialties, they're not don't have a full complement of subspecialists, and so our group does a considerable amount of the pulmonary for them, which involves referring their patients down to see us. And we end up doing the procedures and a lot of the evaluation and management of those patients as well. For many of those patients, that involves coming to Phoenix and being seen in our clinics or even being hospitalized here on occasion when they need the specialized care that we can offer. For a number of years, members of our group are actually driving to Prescott several times a month and doing clinics there. That became just logistically too much of a problem, and so we terminated those clinics probably 5 or 6 years ago. I happened to be working with one of the people at IT, and they mentioned that there was teleconferencing equipment available, and after some work we were able to set up a telemedicine clinic in Prescott where the patients can actually come into the facility there and use the teleconferencing system and talk directly to me here at this institution. I typically will see the patient here one time to become acquainted, but a lot of the follow-up visits where previously they would have to have had to drive to Phoenix, we can now accomplish using that telemedicine system. And so things like fine-tuning medication, following chest x-ray changes, they can just come into the facility in Prescott, we can talk, and the veterans have been very appreciative of that service just because of the time and distance that they don't have to travel.
Right, I bet that's a great help for them.
Well, they really appreciate it, and I think it's something that they're looking to extend to other services, but we were sort of the ones that pioneered that aspect of it.
Well, as we close, I understand congratulations are in order that you were recently named the Clinician of the Year by the American Thoracic Society. What does this honor mean to you?
It was a great honor. I was very pleased just to be nominated, and I'm very pleasantly surprised when I was selected to receive it. It's something where the selection and review is actually done by members of the Thoracic Society, and I find it particularly gratifying to have your work reviewed and recognized by a group of your peers.
Well, congratulations, and thanks again for coming out today and sharing some of the information about your work.
Very good, thank you.
That wraps up another episode of To Your Health. Remember, you can find more information about the topics in today's show by going online to the Phoenix VA Healthcare System website at phoenix.va.gov. I'm Paul Coupeau. Thanks for watching.